Hi, good morning. Okay, in my car again as usual, but I will not be making the whole video here. This is just an introduction. Later on, I will be in my clinic, then dun ko i-record actually yung buong video. But I will be talking about the more permanent form of contraception, which is bilateral tubal ligation. Okay, there. I'm in the clinic now, and as I've said, let's talk about different types of bilateral tubal ligation. So, first of all, I'll show you the anatomy. So, okay, so this is the reproductive tract of the woman. Ang linaligate natin yung mga yon. Okay, the tube. So just to familiarize yourself with the anatomy. These are the different parts of the female reproductive tract. This is the vagina, which serves as the entry into the reproductive tract. Okay, and then this is your uterus. Ang entry niya, okay, is the cervix or yung kwelyo na matres na tinatawag natin. Okay? And then, ito yung matres or yung bahay bata or the uterus. To the side of the uterus, you will see two structures, and these are the fallopian tubes. This actually serves as the passage of the egg coming from the ovaries, o itong dalawang white na to are the ovaries. So every time you ovulate, the fallopian tube actually catches the egg, and then papasok sa fallopian tube yung egg, and it will wait here in this part, in the isthmus, for a sperm to come, and then pwedeng merong fertilization na mangyari, so you can get pregnant. So anyway, so this is the reproductive tract, and when we do bilateral tubal ligation, by the name itself, ang dinaligate natin itong mga fallopian tubes. So there are different, first of all, two timings when we do the ligation. Postpartum, either after normal delivery or during a cesarean section, and interval BTL, meaning after na, siguro kahit after like a year or two after giving birth, tas naisip mo you wanna have a ligation already, then that's what we call interval BTL. In simple terms, basta hindi siya during the time na nanganak ka, na nagpaligate ka, that's interval BTL. So, the more common technique that we actually do here in our country is the modified Pomeroy. So, anong ginagawa natin? We actually grab a portion of the tube. Okay. After creating a loop, we then actually tie the loop, and then we actually again individually tie the two ends of the loop dun malapit sa tinalian natin. Okay. Tapos, ang final dyan is we cauterize the ends just to make sure na completed talaga, na hindi siya magre-recanalize. Kasi we've seen several cases na since these are two healthy tubes, minsan nagre-recanalize after a couple of years, and then magugulat na lang yung mommy na ligated siya pero she got pregnant because nga there are some cases na nagre-recanalize yung fallopian tube. So in order to decrease the chances of that, we cauterize the ends of the fallopian tube that we cut. So this is the most common procedure that we do, the modified Pomeroy. Minsan ang ginagawa naman is self-injectomy. Ano ang self-injectomy? We totally remove the fallopian tube. So, from the, actually the entry niya into the uterus, kakat na natin yon. So, para wala na talagang tubo. So, this will actually, remove the connection between the ovaries and the uterus. So, kahit mag-ovulate ka, wala nang way yung egg para pumunta sa uterus. Wala na ring way yung sperm para ma-meet yung egg. Now, the third type of bilateral tubal ligation that we do here in the country is fimbriectomy. Ano naman yon? There are different parts of the fallopian tube, and the closest part of the fallopian tube to the ovaries, which para siyang finger-like, what do you call this, structures that actually, ang pinaka-role niya is to capture the egg na marirelease ng ovary. That's what we call the fimbria. Okay, so yung fimbriectomy, tatanggalin mo yon. So when we do fimbriectomy, it actually eliminates the capacity of the fallopian tube to catch yung egg pag nag-ovulate. Okay? Your doctor does laparoscopy, pwede ring bipolar coagulation. So, merong device actually na ginagamit sila na sinusunog. So, sinusunog yung, what do you call this, yung fallopian tubes para mag-close. So, makat, tas mag-close yung dalawang ends. So, this will also now decrease the chances of travel of the egg from the ovaries into the area where a sperm might be waiting and fertilization may happen, tas papasok na sa uterus. So, technically, the whole process of bilateral tubal ligation is just basically removing the connection between the ovary and the fallopian and the uterus. Alright, in the States, they usually actually also do tubal clips, tubal rings na ini-insert laparoscopy, through laparoscopy. So, but hindi pa ganun ka-common yan dito. Although, I think some doctors are doing it already, yung mga naglalaparoscopy. Okay, to summarize, so the different kinds of bilateral tubal ligation that we do here in the Philippines. Number 1 is modified Pomeroy. Next is fimbriectomy. Then we also do the salpingectomy. Yun ang mga pinaka-common. Pero kung laparoscopy aided, pwedeng bipolar coagulation. So, pwede rin ang timing ng ligation is postpartum, meaning right after you deliver. Paano ginagawa yon? Sa pusod kami nagbubukas, tapos we try to get the fallopian tubes from there, kung normal delivery ka. Or if you're cesarean section, before we close you up, we actually ligate the tubes. And the second type of bilateral tubal ligation will be the interval tubal ligation, wherein you do it anytime right after basta not within the time na kapapanganak mo pa lang. My car again, but rest assured I'm not moving. So I'm just making this short part of the video kasi I think I forgot to talk about this when I was in the clinic. So number 1, yung side effects, which I think is a very common concern of those women who are contemplating to have a ligation. So what are the common side effects? Number 1, pwedeng ma-infect yung wound. You just need to cleanse daily. Tapos siguro for the first couple of days, pwedeng i-cover. After that, pwedeng tanggalin na yung cover para makasingaw na yung sugat. So, proper wound dressing lang talaga. Next common side effect that most women experience is like a tingling sensation inside, yung para may mga pumipitik-pitik, which may actually coincide with ovulation, wherein kasi minsan nagko-contract yung tubes and yung mga muscles. So, I think that explains the tingling or the parang pulsating pain that you feel. Pwede rin namang nangingilo yung sugat, which often happens when it's cold or when you're in the aircon. So, third common side effect is patients actually complain of emotional lability, meaning nagiging moody daw sila after being ligated. Although there's really no physiologic explanation for this, I think it's really more of psychological kasi what we just did is an anatomic procedure. We cut the tube, we didn't do anything to the hormones, so this is all actually psychological and it's something that you really just have to deal with. Siguro cope with the stress or whatever, or the anxiety. And then fourth, worst case scenario, the tubes can actually recanalize and you can get pregnant again, although hindi naman ganon kataas yung chance of this happening. So these are the 4 most common things that side effects that women complain about when they have a ligation. And then final word, reminder, okay, when we do a ligation, usually number 1, it's when you're 30 or older. We don't ligate pag younger than 30. Next, we need the consent of both the husband and wife. Very important yan. We do not ligate kung isa lang ang pumirma. Okay, so those are the things that you just need to remember. If you want to consider this option, talk to your doctor about it. And there. So there, I hope you found this video very informative. If you liked it, please hit the like button and don't forget to subscribe. Thanks for watching. God bless you all. Bye-bye.